So let us begin with Alan's keynote study streak, and today we'll discuss two remedies which are similar to what we discussed yesterday, or kind of complementary, or the remedies that you will most likely to employ when other similar remedies we discussed yesterday are to be given or have been given. So the remedies that we discussed yesterday was Aranthophyllum and Euphrasia. Today we'll discuss Eupatorium perfoliatum and sabadilla. So the first thing that we read in Eupatorium is the common name, and the common name is bone set. From the common name itself, we should understand that this remedy is going to work on the bones, on the you know, not on the muscles, or especially more on the bones and the bony structures. It will cause pains like those of deeper than that of arnica. So some remedies in the materia medica will be understood from their common name. Some remedies will be understood by the sphere of action more easily, and of course by the provings and symptoms, materia medica, repertory, etc. etc. But this is one of the remedies which you should hold closely in cases of fevers, especially when some indicated symptoms are present. So, what will happen in Eupatorium perfoliatum? How will it be presented? You will get to know very soon. Let us see the first few lines. Adapted to diseases of old people, worn out constitution, especially from inebriety, which means alcoholic people, cachexia, from prolonged and frequent attacks of bilious and intermittent fevers. So, this is a remedy which you should think of in frequent fevers, especially those that come on every 2 days, every 3 days, especially those are of a long duration. You can also think of the remedy in short duration fevers, but that will be a special condition we'll discuss by the time we end the Eupatorium remedy. But the common symptom which you will see in Eupatorium is that there is bruised feeling as if broken all over the body. The other remedies mentioned in the brackets are arnica, bellispur, and pyrogen. Now, what is the intensity of pain in Eupatorium perfoliatum? An arnica patient will tell you that there is a kind of a malaise feeling, inability to work due to physical discomfort. Whereas a Eupatorium perfoliatum will tell you that there is a pain which is breaking my bones, and I feel it's a pain on each bone of my body. That will be your understanding of Eupatorium. It will be something which is deeper than arnica. So if you have seen a patient who is arnica, you will be able to understand Eupatorium perfoliatum. And if you have not seen a patient who is arnica, go out and do some strenuous effort. You will get tired. You will develop feelings of body ache, malaise, weak feeling. That will be the arnica stage. After this stage will come the Eupatorium stage. So many patients that come to you in cases of influenza where there is lot of bony pains, you should think of Eupatorium as the first remedy. Other remedies you can also think of are gelsemium, nux vomica, and in fact it will also be ipecac. So I made a list of remedies which you should give in initial cases of fevers, which you should give in later stages of fevers, long duration, short duration, and different categories. Perhaps that is a topic for discussion in the fever workshop. Those who wish to join the fever workshop, they can get the details and join the workshop, because to explain in a live session is not possible without a PowerPoint, without a comparison of both the remedies together or multiple remedies together is not possible in the Instagram or YouTube live. But the pains in Eupatorium that you see, they come quickly and go quickly. We saw this also in belladonna, we saw this in other remedies also. and the other two remedies mentioned over here are mag phos and Eupatorium purpureum. And then there are bone pains which affect the back, the head, the chest, the limbs, especially the wrists as if dislocated. So all the pains in the bony parts of the body, that will be the complaint of Eupatorium patient. There will be in fact two major complaints in Eupatorium cases. One will be bone pains and other will be inability to drink water because it causes lot of chilliness and lot of shivering inside. Those are the two components which will let you decide to give Eupatorium in cases of fevers or in acute indications. But you can use this remedy also in cases who have been debilitated by fevers, who have the bony pain still remaining after the fevers. That should also point towards Eupatorium perfoliatum, provided the indications are matching. You will have that the complaint that the patients are having bone pains and also the vertigo sensation as if falling to the left side. Cannot turn left to the head to the left side for fear of falling. This is there in the remedy Colocin. And the patient feels as if he is falling to the left side, will be there in Eupatorium. Although very few patients would require Eupatorium, you should rather think of Gelsemium or Conium, or else in vertigo cases it's very difficult to treat. I have discussed it earlier also, and you may think of Veratrum viridi also, Valeriana also, and maybe you will have to individualize and find out. But most of the cases will require any of these remedies, which depend on the age group and also the side which they are falling on, what are the other modalities. Other symptom what is characteristic of Eupatorium and which you have been reading throughout your graduation course and later on whenever this remedy is explained by other homeopaths across the entire different presentations: painful soreness of eyeballs, coryza, aching in every bone, great prostration in epidemic influenza. Other remedy mentioned is Lacan. But for Eupatorium, along with the bone pains, along with the inability to drink water, there will also be lot of pains in the eyelids, which should point to giving this remedy. Heaviness over the eyelids should point towards Gelsemium, but lot of pains in the eyes. You can ask this question and get the clarity over what the patient is feeling, whether it is the heaviness over the eyelids or whether it is just the pain in the eyelids, which is more of aching and they cannot keep the eyes open, they want to keep it closed, they feel that there is a bluish soreness in the eyes. That should point towards Eupatorium. And if you see closely, the entire picture of Eupatorium resembles that of dengue fever. So next we have is cough in Eupatorium perfoliatum, which is chronic, loose, hectic. Chest is sore, must support it with the hands. Bryonia and natrum curve are the other two remedies. Aggravation at night is there in Eupatorium, and it also is a very characteristic symptom which is there after the fever has gone. So patients who have been recovering from fever, if they have body ache, think of Eupatorium. If they have cough, which is easy to bring out, this is the very characteristic symptom, and you will have only single remedy present in the various repertories where expectoration, loose, fever after Eupatorium perfoliatum is 3-mark or 4-mark remedy in many repertories. So you should think of Eupatorium in cases of cough or loose cough which remains after the fever is gone, or after the fever there was no cough episode in the fever cases, but after the fever the cough started, which is interesting to note, and patients will tell you that this is started something after the fever. Eupatorium has promptly relieved many cases at my end also. It is one of the only remedies present in the rubric expectoration, loose fevers after, or cough fevers after. Next you have the last topic for Eupatorium in the Allen's keynotes, and that is fever. Fever, there is mentioned that chill is at 9 a.m. One day it is at 9 a.m., the other day it is at noon, then it is bitter vomiting at the close of chill. So someone who wants to drink lot of water, he tries to drink, and as soon as he drinks he will feel that there is chilliness and there will be lot of vomiting. And as soon as he drinks, he will have lot of chilliness, causes vomiting, and there is bony pains before, during, and after chill. So this is very characteristic for Eupatorium, and if you try to understand it bit by bit, not completely, because there are around 7 to 8 symptoms mentioned in 3 lines of Allen's keynotes, which is difficult to understand at first, but if you have been seeing fever cases, it will become easier. And if you want to even master more about the fevers, you should join the workshop, which is the fever workshop. I'm starting tomorrow from 5 p.m. onwards, every Thursday and Friday, and it will be on Thursday and Friday every week for the 10 consecutive days of the uh, recurring Thursdays and Fridays. Next you have in Eupatorium is insatiable thirst before, during, and after fever, knows that the chill is coming because he cannot drink enough. In fact, there is a very similar action of natramur, and it is closely related to natramur. You can go and read what natramur is what is mentioned in natramur to understand it even more clearly. Next you have is comparison is followed well by natramur and sepia. So you have this very interesting comparison of natramur and sepia with Eupatorium. In fact, all the patients whom you have been giving natramur as constitutional or sepia as constitutional, and if they require acute medicine, especially in fever cases, you can think of Eupatorium. You should think vice versa also. You can compare Eupatorium with also Chelidonium, Podophyllum, and Lycopodium in jaundice conditions. And last but not the least, the comparison for Eupatorium is mentioned with Bryonia, where Bryonia will have free sweats, so there will be lot of sweating, but the pains are not allowing the patient to move. Motion aggravates, we all know this. But in Eupatorium, the patient is restless and there is scanty sweat and the pains which make the patient more restless. So that brings us to the end of Eupatorium perfoliatum, and we go on to the next remedy, which is sabadilla. Why I have taken these remedies in groups? Because they are the ones that will be indicated in most of the cases. They are having similar presentation. Sabadilla and Eupatorium are almost close in many cases of influenza, many cases of coryza and cough. For Sabadilla, we have suited to light persons of light hair, fair complexion with a weak and relaxed muscular system, illusions that he is sick, parts are shrunken, that she is pregnant, when she is merely just distended with flatter. So you know that there is feigning sickness, or even more deeper, it is not feigning sickness. Feigning sickness will come when patients want to tell something that is not present in them, but here they feel as if something is there and it is something which is dangerous, which is harming, or which will endanger their future health, which is a kind of a fixed idea, very close to Thuja, Sabadilla and Thuja. And here they have the feeling that the horrible disease is there in their body. It can be throat, it can be any part of the body, which can be fatal. This is very close to Lacan. If you read synthesis repertory, it has Lacan as well in this particular mention of the symptom. Next you have is Sabadilla for delirium during intermittence. The other remedy given is Podophyllum. Now it is very interesting that we are not able to pick up these symptoms of mind sometimes when the patients tell, and we are not able to correlate from our books. The problem is that in the books it is mentioned in some unique words, some words which may not be known to us. For example, here it is mentioned delirium during intermittence. Now a patient who is having a fever since the last 1 week, and on the 4th or the 5th day he starts muttering in his fever state. That is what actually means delirium during intermittence. It can be that he is imagining something, it can be that he is thinking something. You can take the rubric muttering, morning, fever during, muttering, morning, heat during, but you can also choose this rubric delirium during fever, and you will reach the right remedy. So to understand these states needs a bit of an explanation and bringing together everything that you have read from the different aspects, whether it is present in delirium, whether it is present in moaning, muttering, loquacity. All these have more or less one remedy plus or minus, and you need to study that to prescribe it at a better level. Next you have is worms. For worm indication, sabadilla is one of the best remedies. Worm affections of children, Sina, Silesia, Spigelia. So in fact there needs to be much more light and broader study on how homeopaths deal with worm cases and worm manifestations in allopathic setups. They are just giving albendazole and the patient is cleared of the worms. But how will a homeopath deal? And we can restrict the patients to avoid these, albendazole and all these medicines. One of the first things is that give a dose of schirinum 30. Okay, for worm cases, you should always give a dose of schirinum 30 or schirinum 200. Just make a note of it. It's going to change your the way you practice in your clinic. Schirinum 30 or 200, one dose every 15 days, and the other medicine should be, which should go on regularly, which should be the indicated medicine. This both in conjunction will help ejaculate the worms. I have given it in innumerable cases, schirinum 30 or 200, one dose every 15 days for 2 months or 3 months, and that is going to expel all the worms. You can think of sabadilla, you can think of Silesia, you can think of Sina, Spigelia, based upon the indications, or else based upon the constitutional medicine of the patient. So suppose you are giving someone natramute, then you can think of maybe Sina or Silesia as a remedy. If you are giving them sepia, think of Spigelia as one of the remedies for worms. In this way you will need to find a comparison of the chronic remedy with the acute remedy which is present in worms and prescribe to the patient. It's going to expel lot of worms without any need for allopathic intervention. So sabadilla will be indicated in children or patients, adolescents or teenagers, where they are excessively worried about some or the other problem which is disturbing them, and they will have some worm symptoms or worm manifestations. They will have headache because they are studying a lot, they are focusing a lot. That should be your way to pick up the different components from the Allen's keynotes and prescribe sabadilla. So there is headache from too much thinking or too close application or attention, like the remedy argentum nitricum, and from worms. In the next lines you have throat complaints for sabadilla, diphtheria, tonsillitis, can swallow warm food more easily, stitches and most symptoms especially go in the throat from left to right. So you should make your parameters and write down all the remedies which affect the throat from left to right. These are sabadilla, these are like lacasis, lacan, rustox, and then you make a list of all the remedies that affect right to left. For example, it can be lyco, it can again be lacan, it can be phytolacca, it can be belladonna. In this way, when you have your customized case taking format and the remedy format for certain conditions, your job to prescribe becomes quicker and faster, and then you just need to ask direct questions or something that leads to certain remedies, just because patients are not able to elaborate more and they are just telling you the common symptoms. So this can be one of the techniques of case taking. I have discussed some such useful techniques in my case taking workshop also, which we conducted in the month of January. If anyone wishes to have the recordings, they can definitely write back to us. And you have throat complaints of sabadilla, which we are discussing right now, which in which they have complaints from left to right, and there is sensation of skin hanging loosely in the throat. Must swallow over it. Very few times you will encounter these sensations. I have been telling it in all my past sessions, but what you will encounter are the modalities, are the side effects. So you can focus on these aspects and get your clarity over your prescriptions. Okay, so next we have dryness of the fauces and the throat, sneezing in spasmodic paroxysms followed by lacrimation, copious watery coryza, face hot, and eyelids are red and burning. So all the patients that require medicines as an acute in allergic manifestations can be given a dose or a bottle of sabadilla. This is going to give you a lot of blessings and also a lot of patience. So it will not stop immediately. That is an underlined statement, a bold statement. But over a period of 3 to 4 months, when you are treating a patient of allergic rhinitis, atrophic rhinitis, over a period of 3 to 4 months, you will see considerable reduction of their intake of any allopathic medication if they are taking, and also the number of paroxysms that they encounter every day. So it's a process that happens over a period of some time. You cannot just tell them that overnight it will stop. It will take some time for them to stop. Next you have is in sabadilla, very interestingly, nervous diseases, twitching, convulsive tremblings, catalepsy from worms. The other remedies mentioned are Sina and Sorinum. So how will you differentiate? You can find out whether there is lot of hunger. If there is lot of hunger, you can find out if it is Sorinum or Sina. If there is no hunger, then you can think of sabadilla. So make your own landmarks, and that is going to lead you further to prescribe medicines. Otherwise you will always be relying on the books, and the books will not give you what are the landmarks that you need to pinpoint or help you prescribe the remedy, because the books have the entire list of symptoms mentioned. That is one of the things a homeopath should develop himself. Last but not the least, we have skin symptoms in sabadilla, which is there is lot of parchment like dryness, and in relations you have colocynth, colchicum, lycopodium, where there is also similar aggravation of 4 to 8 pm, and there is uh, amelioration by open air in pulsatilla and sabadilla, both the remedies. So last we have something which is of a very special note. Patients who have chest infections, they can be given sabadilla provided aconite and bryonia have failed, and you can compare remedies such as bryonia and ranunculus bulbosus, very similar in lot of things related to chest complaints with sabadilla. So that brings us to the end of two remedies, Eupatorium perfoliatum and sabadilla. And maybe tomorrow we'll take up tomorrow. Okay, I'll be having a fever workshop, so the Allen's keynotes study streak will begin again. Will resume from Saturday. Meanwhile, tomorrow and day after tomorrow we have the fever workshop at the same time, 5 to 6:30 p.m. All those who wish to join are welcome to join, and you can get the details from my team, and it's going to be a good learning to help you prescribe and give the confidence in fevers. So that's all from me right now, and at tonight if you have any questions related to fevers, just drop them in the comments of any of my fever related posts. You will get an answer, or else watch out for a story with the comments. The ones who are watching on YouTube can directly join in the session at 9:30 p.m. and ask me live about your questions, and I'll definitely make sure to answer it.